In this video, we want to discuss about Alzheimer's disease and the drugs that are used to treat. And as we begin, we remind you to subscribe, like the video, and share your comments. And what is Alzheimer's? So we want to start by defining what Alzheimer's disease, what are the causes suggested to lead to Alzheimer's disease, and different drugs, then plus their indication and adverse reaction, how they occur. And by definition, Alzheimer's disease is a form of dementia. It's a form of dementia characterized by memory loss and cognitive impairment. Cognitive impairment. So these people with Alzheimer's disease, they have dementia, which is characterized by memory loss, whereby someone forgets easily, especially in elderly, and cognitive impairment, loss of judgment. That is what we can call Alzheimer's disease. And the probable causes is due to accumulation of beta amyloid. If there is accumulation of beta amyloid in the cortex of the brain, especially the affected neurons are the cholinergic neurons, it leads to neurofibrillary tangles. And these neurofibrillary tangles leads to the loss of cortical neurons and especially cholinergic neurons. And when there is loss of cholinergic neurons, meaning there is no acetylcholine neurotransmission, hence leading to cognitive and memory loss. That is what we can see, one of the hypotheses, which is due to accumulation of beta amyloid plaque in the cortex or in the hippocampus region of the cerebral cortex. And when it happens, then another second hypothesis is that it is due to when there is overproduction of glutamate neurotransmitter. This one leads to overstimulation. Overstimulation of NMDA receptors. And when these NMDA receptors are overstimulated, we are going to see increased influx of calcium ion into the postsynaptic, and this one can result into apoptosis, which we call programmed neuron death, especially the cholinergic neurons, or sometimes this glutaminergic. So these are the two hypotheses, either accumulation of amyloid plaque or overstimulation by glutamate leading to apoptosis and cell death. So the two different mechanisms, we are going to see if we have acetylcholine neurotransmitter. It is taken up within the synaptic vesicle where it is stored within the presynaptic neuron, and upon entry of calcium ions, it leads to exocytosis. They are released by exocytosis into the cleft, and when these neurotransmitters, acetylcholine, are released into the synaptic cleft, they have the receptors where they bind called the muscarinic or nicotinic receptors. But this one, since it is in the central nervous system, we see nicotinic neuronal receptors. And when they bind, they cause inside of the cell due to entry of sodium ions, leading to propagation of an action potential. But these ones, they are short-lived due to presence of an enzyme known as acetylcholinesterase enzyme. That this acetylcholinesterase enzyme, it does the role of degrading or metabolizing acetylcholine in the synaptic cleft, and it breaks it down to two components, that is choline and acetate. That is what enzyme acetylcholinesterase do. So we are seeing if we can get drugs that can inhibit the action of this enzyme, we can prolong or increase the neurotransmission of acetylcholine within the cerebral cortex, hence preventing these memory loss and cognitive impairment. That is one category of the drug which we are going to discuss here, acetylcholinesterase inhibitors. Then the second category, we are going to see that if we have neurotransmitter, that is glutamate, in the presynaptic neuron, when it is stored in the vesicle and is released by exocytosis in the synaptic cleft, here we have this postsynaptic neuron with these are calcium gated channels, and these calcium gated channels, they have a receptor for glutamate, and these receptors, they are the one we are naming NMDA receptors. So when there is overproduction of glutamate, glutamate comes and binds on the NMDA receptors, leading to the opening of calcium gated channels, and then we shall see influx of calcium from the cleft, increased influx, much entry of calcium inside the postsynaptic neuron, and increased entry of calcium in the postsynaptic neuron is the one that leads to apoptosis, which leads to cell death or neuron death. This is programmed cell death. That is another mechanism. So we are going to see other drugs or another drug which we can use to inhibit binding of glutamate. If glutamate is released, and if we come and we get a glutamate antagonist which prevents binding of glutamate to the NMDA receptor, we shall reduce entry of calcium. So without wasting any time, let us see these drugs. And the first category is acetylcholinesterase inhibitors. And examples of these drugs, we're going to see examples like donepezil, going to see a drug like rivastigmine, and garantamide. These are the drugs we are of choice. Then we had another drug known as tacrine. It also has ability to cross the CNS, but it was stopped due to its hepatotoxicity effect on the liver and its short half-life. It had also short half-life, meaning in a day you need to give like 4 times. So that's why it was stopped majorly tacrine. So currently we are utilizing donepezil, and donepezil is the best because it has long half-life and it is given OD because of its long half-life compared to others. Then another ones, we are going to tell you that donepezil and rivastigmine, these ones, they are uncompetitive. So uncompetitively, they act by binding to acetylcholinesterase enzyme, hence inhibiting it from breaking down acetylcholine to choline and acetate. And when it is not broken down, we increase the concentrations of acetylcholine in the synaptic cleft, hence increasing their chances of neurotransmission, and we are able to treat these symptoms of Alzheimer's disease. So these drugs do not treat the disease, but they reduce the effects or the signs and symptoms of Alzheimer's disease, but they don't treat. Then garantamine is the only drug that binds competitive. It is a competitive inhibitor of both. It is competitively inhibit acetylcholinesterase, whereby these ones are uncompetitive. So it is very important to know that. That is garantamide. And these drugs, they are used in the treatment of acute Alzheimer's disease. Acute Alzheimer's disease. Then the side effects of these drugs, we are going to see side effects like meiosis can occur, GIT effects like nausea or vomiting, can see diarrhea. You can see effects like we are going to see effects. We have diarrhea, we have salivation, we can have sweating as a side effect, and so on, even bradycardia. And this bradycardia can result into hypotension, decreased respiratory, decreased heart rate, can result into hypotension. So these are the side effects when you are on donepezil, rivastatin, and the galantamine. And apart from being used in treating acute Alzheimer's disease, they can also be used in treatment of myasthenia gravis, which is seen under autonomic nervous pharmacology. In autonomic nervous pharmacology, we use them in the treatment of myasthenia gravis. That is very important to note. Then the last one we can discuss is the NMDA receptors, what we call N-methyl D-aspartate antagonist. And these drugs, for them, their mechanism of action, they act by binding to NMDA receptor, and when they bind, they partially reduce the influx of sodium. So these are partial antagonists. This is a partial antagonist, whereby it reduces or it decreases influx or entry of calcium ions. And when calcium entry is reduced, meaning it decreases programmed cell death, what we call apoptosis. Hence, the neurons remain viable. And the example of the drug in this category, we have majorly, this is the drug, memantine is the drug which we use in treatment. And this memantine is used for treatment of moderate to severe Alzheimer's disease. So we can use it in advanced Alzheimer's disease. Memantine is the drug of choice. So sometimes we give it in combination with acetylcholinesterase inhibitors. And the adverse effects, that is adverse drug reactions of this drug, include constipation, can lead to constipation, and result into constipation, and result into somnolence. Somnolence is also another. Somnolence, this is being sleepless, feeling sleepy. This one causes increasing sleep moods. Then another one we can talk about can lead to confusion. So these are some of the side effects of this memantine drug, which is used in the treatment of moderate to severe or advanced Alzheimer's disease, to manage the symptoms so that we can enhance memory, but not treating the disease or neurodegeneration. So we said this is as we are completing, this is a neurodegenerating disorder due either to accumulation of amyloid plaque that destroys cholinergic neurons, or overstimulation of NMDA, which leads to programmed cell death. And the drugs we have seen are acetylcholinesterase inhibitors. And we have seen among them, donepezil is the drug of choice because it's given once a day, whereas tacrine was stopped due to hepatotoxicity effects. We have seen the side effects. Then we have seen a partial antagonist for NMDA, that is N-methyl D-aspartate antagonist, which blocks the apoptosis, and they use it in the treatment of advanced Alzheimer's disease. Thank you so much for learning with us at Medical Sciences. May God bless you.